friends, and welcome to another episode of Heroes Headquarters. Today we celebrate the tireless and extraordinary efforts of Dr. Marcelo Cypel, a thoracic surgical oncologist from the University Health Network in Toronto, who treats colorectal lung metastases. And at the same time, we honor the brave and remarkable journey of long-standing CRAN member and stage 4 patient Bill McGinley, who was successfully treated for a stage 3 rectal cancer and had acquired a no evidence of disease status for 10 years, but then experienced a recurrence in his lungs, retroperitoneum, and pelvis in 2018. Bill had a great response to chemo and bevacizumab for his stage 4 disease, but importantly, thanks to the extraordinary efforts of Dr. Cypel, the disease volume has been significantly reduced in both his lungs. Sit back, my friends, and listen to this incredible story moderated by Mr. Ryan Clark from Eversana, Canada. It is an inspiring account of a patient's desire to move forward with determination and perseverance, thanks to a world-renowned expert. I promise you, you will not regret watching it. Thank you.
Dr. Marcelo Cypel is a staff thoracic surgeon at University Health Network, UHN, senior scientist at the Toronto General Hospital Research Institute, and associate professor of surgery at the University of Toronto. He is the surgical director at the Edgemara Transplant Center and the surgical director of the Artificial Lung Program at UHN. He developed a new method of donor lung preservation and repair called ex vivo lung perfusion, or EVLP. This method is now used clinically in Toronto and many other centers and has significantly increased the number of transplantable lungs. Dr. Cypel is also a member of CRAN's Medical and Scientific Advisory Board. Bill McGinley was originally diagnosed with stage 3 colorectal cancer at age 38. After 2 years of treatment comprised of radiation, surgery, and chemotherapy, he was deemed no evidence of disease for approximately 10 years. Then in January of 2018, at the age of 50, as a result of routine annual testing, he learned that his cancer had returned, this time at stage 4. Having previously built a relationship with CRAN when he was originally diagnosed, Bill returned back to Philomena for support with what he calls the second leg of my cancer journey. Bill is also the current chair of CRAN's Patient Advisory Council. Bill, tell us a little bit about your story. We've sort of had an overview, but maybe fill in some of the gaps for us, and perhaps also leading up to your first meeting with Dr. Cypel.
Yeah, absolutely. So as you mentioned, Ryan, I was originally diagnosed with colorectal cancer at quite an early age. And at the time, I had 4 young children, Kaylee, Allie, Rowan, and Riley. And there was absolutely no way that I was going to give up in terms of my journey, my ability to look after those little rascals. And as Philomena helped me navigate the journey from the darkness into the light, I was actually able, as a result of some very successful treatment, to be no evidence of disease for 10 years. And I was really quite thankful for that time. I thought cancer was in the rearview mirror for me, but unfortunately, it did come back after 10 years. It was discovered through routine testing at Women's College Hospital at the After Cancer Care Clinic. And as a result of that routine testing, it drove me back into two different streams. First of all, I reached out to Philomena again right away and her support group, because I knew that I would need help on this second leg of my journey, help to navigate, help to receive advocacy and navigate for the best care possible, and also to become aware of the best care possible so that I could work with the group to navigate some of that care myself. And I met Dr. Cypel during a symposium that CRAN was putting on. where a number of different oncology specialists were talking about some of the great work that they were doing. And this is where Dr. Cypel presented some of the work that he was doing, especially with lung metastases from various cancers, including colorectal cancer. And I was so enthusiastic that during his presentation, I actually virtually put up my hand and typed a message, "Would you see a fellow like me in clinic?" and described a little bit more about the stability of my disease and some of the treatment I had been through. And he agreed to at least have further discussions with me, for which I will forever be grateful.
So Dr. Cypel, let's maybe pick up on what Bill just said. So this patient puts up his hand in a virtual form and you agree to see him. So what happens next? What happened when the two of you connected?
Yeah, so I received the referral from his medical oncologist to see him, and and then I evaluated his history and and the chest CT. So evaluated his lungs. So at the first look, oftentimes we'll see the CT scans and the imaging even before seeing the patient, of course. And when I look at that image, my first impression was, I don't think he will be a candidate for surgery. There are just too many lesions, right? And then we met, and and then I got more details of his history, and the fact that he had the original cancer, more than 10 years prior. And the fact that took all this time for the lesions to come back in his lungs, I think that was an important aspect. And then I kind of opened the discussion about maybe surgery could be a possibility, but let's observe things for a bit longer first, okay? Because we want to see if when I see you again in 3 months, if now you have, let's say, 10 lesions in each lung, and in 3 months you have 20 in each lung, then I would say, probably surgery is not going to help you, right? And Bill understood that quite well, and we continue, talking and following, and over the months, we saw that in fact that there were not new lesions coming up, and even the lesions that were there, they were either not growing or growing very slowly, and so those are things that the textbooks, they don't tell you. The textbooks tell you if you have more than X number of lesions, you should not do surgery. But that's a very, clear-cut type decision. And, there are so many other interactions that should be put in consideration, from the cancer biology's perspective, how is the patient responding, or fighting the cancer with their immune system, how are they responding to the systemic treatments and so on. And, and then, we basically, over those months, we said, well, maybe we can consider surgery in your case, and given these particular aspects, of your disease.
So, Bill, tell us about how you go to see Dr. Cypel, and as he's sort of wonderfully described it, we have to wait and see, but there's hope. There's a chance. Tell us about how you felt over that period, and how, I guess, you sort of the two of you kind of grew together where you got to this point.
Yeah, so I really strongly considered and was really strongly interested in pursuing surgery with Dr. Cypel, because I had a very good feeling that if we were able to remove the cancer from my lungs, we would remove the most immediate threat to my life, because the cancer in my lungs was the only place that it was in a vital organ. And so, basically whatever Dr. Cypel was going to ask me to do, I was going to make sure I was determined, doggedly determined, to take my medicine and do exactly what he wanted to do. And so we actually ended up taking about a 5-month chemo break. So with all of our various discussions, we took a 5-month chemo break. And as Dr. Cypel mentioned, we didn't notice that the number of lesions exploded. And we also didn't notice that the burden of disease necessarily got more heavy or troublesome in my lungs or my retroperitoneum or my pelvis. And as a result of that, I do feel so blessed that Dr. Cypel really did treat me, as I mentioned, as an individual rather than a statistic, and took into consideration the various things that he's talked about in terms of the biology of my disease. And I think the courage and determination with which I wanted to move forward, knowing the potential risks as well as the rewards. And I was, when I met with him in clinic in August, late August, and we made a plan of care. I met with him again briefly in September, and then within a week, we firmed things up, and I was on the table for my first surgery. And I was so thankful for that particular moment.
So Dr. Cypel, it sounds like you had a real partner in Bill, obviously in his care.
Yeah, so I mean, as Bill mentioned, I think these several meetings, were very important, right? To make that joint, at the end of the day, ends up being a joint decision, right?
Bill, you touched on a little bit about the psychosocial support that CRAN provides, and I mean, your journey is one of some period of time. Can you talk a little bit about what you went through, sort of from a psychological, emotional perspective? Obviously, your family, you've touched upon that, but particularly the support that CRAN has provided for you now for over 10 years.
Yeah, for nearly 15 years now, actually. But so I think, I said it before, but two things really stick out to me when it comes to the psychosocial support. One is the environment that CRAN promotes, so the environment that Philomena promotes, and that's an environment of loving care. And really, it's all patient focused, so membership focused, loving care, but it promotes love and care in two or three ways. One is that it promotes a lot of love and care within the family itself. So we provide at CRAN, Philomena and her team, which I'm a member of, we provide the right atmosphere for caregivers to interact with the people at home that have cancer, and for them to encourage and love each other through the journey, which is so important. And it's actually one of the things I'm most touched by, is how close it brings families together. The other thing that I really appreciate is the love and care between patients at CRAN, and that is that we look out for each other. So we're always there to provide advice, to be available for phone calls. I love texting people when I don't feel well or I'm scared about something, and I love receiving their text when they're in the same boat, so that I can provide a little bit of support and so forth to help them along their journey. And then lastly, everybody is very admiring and thankful for the care that Philomena provides to each individual, both on an individual basis as well as on a group basis. So I think it was instinct to me to reach out to CRAN when my cancer returned, because I had received such good care the first time around. And I can't imagine being on this leg of my journey without that support. I can't imagine navigating the kind of darkness that cancer brings upon an individual and or a family without the support of Cran and Philomena.
And Dr. Cypel, you're obviously a very busy clinician, but you've chosen as well to be involved with CRAN. Tell us about the importance of the organization from your perspective.
Yeah, so I mean, for us, it's quite important to know that the patients have this type of support as well, and I think these educational activities are also, I think, quite important, and having also, you know, an organization that advocates for the patient. I think it's also, I think, very important, because sometimes you may feel a bit discouraged, you know, doing this or that, and you see that the patient and the institution advocate, you know, for such, you know, an intervention or participating in a clinical study and so on, and sometimes you end up changing, you know, your initial approach. So and I've seen from CRAN that they advocate actually very hard for the patients, and I think that's really wonderful.
So as we draw to a close, perhaps I'll ask each of you. I'll start with you, Dr. Cypel. Perhaps you could just leave us with some final wisdom and any advice you would have for patients like Bill who may be facing similar challenges. What sort of thoughts would you like to leave with them?
Yeah, I think the first, you know, I think we learn a lot with the patients as well, right, as the years go by, and I think again, advocate for your case is important. You know, be optimistic about your disease. I mean, this is something that it's not scientifically proven, but I do see that patients that are more optimistic with their disease, they tend to do better, you know. Again, I think don't try to give up at the first, you know, diagnosis. I think that's really important. I think Bill is a clear example of that. And, you know, many times the interventions that we can offer, they may not be curative, okay, but they may control the disease, and
Yes.
and controlling the disease may be good enough for the time being, right? Maybe with all the research that is happening, you know, in a couple of years, there is something that before was controlling the disease, now is curing the disease, right? So I think that's a good way to try to think along those lines when the disease is a bit beyond where, you know, we would like to be at the time of diagnosis, for example.
It's very good advice. And Bill, I'll give the last word to you. We've had the chance to hear your story today. I've had the chance to read your story. It is truly extraordinary. What would you like to leave the viewers with today? Any final thoughts from your perspective?
Yeah. So thank you for that. Never give up hope, right? So never give up hope. I think that it's so important. All of us have so many reasons to stick around and be really quite hopeful. And my reasons include Kaylee, Allie, Rowan, and Riley, and my lovely wife, Kim. And, you know, there's so many meaningful things in my life, everything from working hard at my business to my continued dreams of travel. But family, friends, love, hope, all of that with a little bit of dogged determination and some courage will get you an awful long way, I think. And I want to take this opportunity to thank Dr. Cypel from the bottom of my heart. For treating me as an individual and not a statistic. Thank you, Dr. Cypel. Thank you very much.
Thanks so much, Bill. And I also thank you for your courage, and you are also teaching us how to best care for our patients, and what you're doing, it's also going to help other patients as well in the future.
Thank you.
Thank you both.